I'm Allison Crosby, and this is my culturally competent video. I have here with me today Jolene and Joanna. They are nurses here that work with me here at Trinity of Augusta in the ER. So we're going to get started. How to provide culturally competent care. I picked the Asian Chinese culture. Can you see it? Yes. According to the 2010 census, the estimated number of U.S. residents of Asian descent is 17.3 million. Of this number, 3.8 million are Chinese descent, which is the largest Asian group living in the United States. According to the Office of Minority Health, cultural and linguistic competence is a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. It's that way patients and doctors can come together and talk about health concerns without cultural differences hindering the conversation but enhancing it. That's what they define as culturally competent care. Why is that important to nursing? Reported by DeRosa and Conchura, culturally competent care links professional knowledge with cultural knowledge to address the patient's health needs and cultural preferences. Care that is culturally sensitive avoids the conflicts that end in no-win situations in which the healthcare provider feels frustrated and the patient and or family feels guilty and or alienated. So it's important to nurses so that we can communicate with our patients so that we know that their culture and their beliefs. Other reasons why this is important. Additional benefits include more effective use of time with patients, increased disclosure of patient information, decreased patient and staff stress. You know, we're stressed here in the ER, so we want to decrease that as much as we can. Greater trust in the patient-provider relationship, higher patient satisfaction scores, and compliance with increasingly stringent government regulations and medical accreditation requirements. There are 4 different traditional religions and or philosophies in China: Confucianism, Buddhism, Taoism, and of course ancestor worship. Many Chinese Americans practice Christianity also. The Chinese language has many dialects. Mandarin is the official Chinese language, but many Chinese Americans speak Cantonese and other dialects. Excuse me. Individuals who speak any of the Chinese languages or dialects can read any Chinese written language. It's not necessarily the one that they tied to their spoken language, but they can read all dialects as it's written. Speaking of Confucianism, I can't say that, I'm sorry. It is the transformation of ancient and traditional Chinese religious beliefs and practices. They center their ethical and social dimensions and effects. Its primary purpose is to achieve harmony, and the most important social value is harmony. Other principles that are important to this religion is filial piety, which is the support and obedience of parents, care of oneself, offspring and reverence of ancestors. Care of the elderly is a family responsibility, especially to the oldest son. Proper conduct, control of emotions, restraint, obedience to authority, conforming, and face are highly valued and important. This religion may burn incense, use good luck symbols, eat special foods, use herbs, acupuncture, and or other traditional medicines. Buddhism is a religion of understanding rather than belief. Buddhism sees life as an inevitable process of birth, aging, illness, and death. They believe that the liberation from suffering occurs through the doctrine of the middle way or attainment of enlightenment or nirvana. Teachings also emphasize face or dignity. An individual's wrongdoing causes immediate family to lose face. They may be vegan, lacto-ovo, vegetarian, or semi-vegetarian. They don't generally use alcohol or tobacco products. They pray usually 5 times a day. Their last rites are performed by a Buddhist monk, and they prefer cremation. Strongly believe in karma. They are considered bad luck to talk about illness or death, as that it may happen. Let me get that off my screen real quick. They also may burn incense, use good luck symbols, eat special foods, use herbs, acupuncture, and or other traditional medicines. And that's Buddhism. Taoism. It's an ancient Chinese way of life that advocates that one should let events run their natural course, keep a tranquil mind, and live as close to nature as possible. Simplicity and humility lead the way to personal harmony, also known as the way. Emphasis is on selflessness, cleanliness, emotional calm, and conformity. Taoist masters may perform exorcism of malevolent spirits causing illness or misfortune. They too may also burn incense, use good luck symbols, eat special foods, use herbs, acupuncture, and other traditional medicines. Excuse me. Nursing considerations for the Asian Chinese religious beliefs. Patients should be consulted about the practices that are important to them. The father is the undisputed head of the family. Traditional Chinese values put the family and society over the individual, so they may make decisions based on what the decision for the whole family is, not just that one individual patient. Traditional deference, to authority may produce miscommunication. The patient may nod or smile and or say yes or ya to acknowledge that he or she heard you, rather than that he or she understands or approves what you are saying. The patient may be reluctant to say no to a doctor or a healthcare provider because it may be considered disrespectful or cause disharmony. Traditional remedies include herbal medicines, coin rubbing, cupping, and therapeutic burning or moxibustion or acupuncture. Other nursing considerations: physical illness caused by imbalance of yin and yang, or they're hot and cold. They may use food to restore yin and yang balance and may prefer only hot liquids when sick or postpartum. May not complain of pain. They may be stoic, and so be aware of nonverbal cues, and they may not ask for pain medicines for the same reason. Eye contact is avoided with these patients because authority figures is seen as a sign of respect. In other words, they will not look a doctor in the eye. Asking questions seems disrespectful to them, so silence may mean respect. It's not that they are ignoring us or just don't understand. It's a sign of respect for that religion. They may wear good luck articles. Jade is a big one. Rope around the waist. They may be worn to ensure good health and or good luck, so we must avoid removing them. And using a first name may be viewed as disrespectful to them. Bad medical news is often shielded from the patient by the family in belief that telling the patient will only make the patient's condition worse. This begins with karma. Have a more relaxed attitude towards time. Being on time is not a value to their tradition. They may feel uncomfortable with physical contact during conversations, and the left hand is considered unsterile or unclean, so if we do anything or hand anything to them, make sure we hand it to them with our right hand. They prefer to retain their full complement of body parts for the afterlife, so they may be hesitant with surgery to remove like a gallbladder or a hysterectomy, or organ donation may be resisted. Barriers to health care include acceptance by patient and family, mistrust, money. They may not have the money to get the proper health care. Saving face, a lot of times with psychosocial or psych issues, they may be unwilling to bring it up because they're trying to save face and not ruin the family's image. Family responsibilities is a big one. Like I said, filial piety, the son has a lot of responsibility, and so does the oldest son's wife. Language barriers, a lot of times they don't seek medical care because there's a language barrier there. You don't understand them, they don't understand us. Lack of culturally competent services, in other words, doctors that don't understand their culture, they may be hesitant to go to them. And geographic barriers. There is a high rate of noncompliance with Western medications. A lot of people in this culture believe that the Western medications are too strong, and they may not take the prescribed doses or may be at risk for drug interactions due to the concurrent use of herbs and other Chinese medications. And that is the end of my slides. I appreciate y'all's cooperation with it. Any questions? No? Okay. Thank you. This concludes my culturally competent video.